Is this safe for me and my child? Maybe the most important and problematic question that moms ask. As parents, our children are the center of our world. The love we feel is truly unmatched when we are born. However, parenting also comes with worrying about their health, development, and future well-being every step of the way. Today we're going to talk about the effects of Tylenol that it has on our children. Maybe you're pregnant, maybe you have a newborn, or your baby's already a few years old. If at any point during your pregnancy you're considering the popular medication Tylenol for pain, fever, or any discomfort that arose, then this video is specifically for you. Here's why. Over the past decade, several major studies have surfaced showing prenatal acetaminophen exposure correlates to an increased risk of neurodevelopmental disorders like autism and ADHD later in childhood. I know, scary to think about, right? But here's the good news. This video will explore what the emerging research on Tylenol and autism currently shows, where the scientific debate still lies, and most importantly, how you as an expectant or new mom can fully make informed choices about medication safety during pregnancy and moving forward. Knowledge is power, and our goal today is to empower you. This video provides important information for any woman who has taken or is considering taking Tylenol during pregnancy. We'll explore the latest research on links between prenatal acetaminophen exposure and autism spectrum disorder risk, current scientific uncertainties, and guidance on wise medication use during pregnancy. This was exactly Beth's story. She was pregnant with her first child while working a full-time desk job and had a history of headaches and migraines. To keep going throughout the day, she utilized over-the-counter meds such as Tylenol. But after researching and reading some articles online and in a first-time moms group, she got nervous. Is this safe? What are some other options? After a few friends mentioned neurologically-focused chiropractic care, she thankfully found our office. While scientists still debate if it's causation that underlies the link between acetaminophen and ASD, let's walk through what multiple major studies have reported. In short, significant epidemiological research has found an association between prenatal acetaminophen exposure and autism spectrum disorder. For example, a major study published just in 2020 measured biomarkers in almost 1,000 umbilical cords. It found over 3 times higher autism rates in babies exposed to the most acetaminophen versus the least. Additional studies have found this correlation. For instance, one examining over 70,000 mothers found about a 20% increased risk of borderline or clinical neurodevelopmental issues like ASD and ADHD among acetaminophen exposed children. However, some argue these observational findings do not yet prove cause and effect due to method limitations. These retrospective studies have relied on mothers self-reporting medications used months or years later, which risk inaccuracy. Some analysis indicate accounting for family psychiatric history seems to eliminate or weaken the acetaminophen ASD connection, suggesting it could stem from shared genetics more so than the medication itself. Overall, though, most experts have called for urgent additional investigation given public health implications if an ASD link exists. Several medical groups now advise closer analysis of acetaminophen safety data and guidelines for pregnant women given accumulating evidence. Guidance for expectant mothers remains to first, try non-drug approaches like chiropractic care for pain relief and only utilize Tylenol when clearly medically necessary. Discuss personal risk tolerance with your OB and consider alternative options. If using, ingest the lowest effective acetaminophen dose for the shortest duration possible and avoid prolonged high quantity intake. Bottom line, while avoiding acetaminophen entirely during pregnancy seems unnecessary for most, carefully weighing its still uncertain risks versus benefits is wise. If research ultimately proves prenatal acetaminophen use heightens the odds of neurological disorders like ASD, it would fit with a larger paradigm shift happening in medicine. We now understand autism's causes extended far beyond genetics alone. Instead, the complex interplay between prenatal stressors, birth trauma, child gut health, toxins exposure, infections, and more creates a perfect storm disrupting early developmental processes. The intriguing connections between popular medications like acetaminophen and infant brain development represent one potential piece of autism's intricate puzzle. This emerging knowledge empowers mothers to become informed consumers regarding medication choices that could impact their children for life. And for families already on the autism journey, take heart. With a greater understanding of ASD's neurological components comes an advanced interventions like neurologically-focused chiropractic care that can truly target root causes, not just suppress symptoms. Whether you are pregnant or have already had your sweet babies, safeguarding their future means supporting all women and making educated decisions about pregnancy interventions today. From fertility to birth and beyond, our children's well-being first depends on empowering mothers with information and choices. To learn more about drug-free support options for a healthy pregnancy and baby development, check out Innate Family Chiropractic and click our link in the bio to read more on the research of Tylenol.